Good afternoon, everyone. Welcome to our town hall today. This is an urgent town hall to discuss the topic of the vaccination clinics and the approach being taken to ensure a rapid and accelerated rollout of the vaccine to hospital healthcare workers. I'm not going to dwell on too many details other than to say we're going to try and answer as many questions at the end of this as we can, but also have a town hall booked tomorrow. And we'll talk more about that at the end of the presentation. I'm going to ask our President and CEO, Rob McIsaac, to kick things off today with some introductory remarks, followed by some of our colleagues.
Yeah, thanks very much, Aaron, and thanks all for taking the time to join today's town hall. As Aaron indicated, today we're focused on the rollout of the COVID-19 vaccine to our staff, physician, residents and learners. We'll have our regular town hall tomorrow as well to cover other items related to pandemic planning and response. So today you're going to hear from Les Gauthier, our VP Clinical Support Services and Surgery, Michael Stacey, our Chief Medical Executive and EVP Academic. They are going to share specific details about how and when HHS staff, physician, and residents will be able to receive the vaccine. Before I hand it over to them, I want to make a few comments. First, I'm sure many of you have been frustrated because you haven't yet had the vaccine. I understand that. Toronto and Ottawa got a head start on the rest of the province in getting vaccine. So it's been very frustrating seeing their tweets about getting vaccinated while we haven't. You should know that we've been advocating at all levels on your behalf to get you the vaccine as quickly as possible. Now that we are receiving deliveries of the vaccine, we are doing everything within our power to get maximum vaccinations to our workforce as soon as possible. It's important to understand that the prioritization of the vaccine was set out in a ministry guidance document, and long-term care was their first priority. There has now been some loosening of the guidelines, and accordingly, we are taking advantage of that to quickly ramp up how much vaccine can be administered to staff and physicians. Every staff member, physician, resident, and learner who wants the vaccine will get it in the coming weeks. We are sequencing the administration of the vaccine in the most equitable and ethical means possible. I want you to know I am in the 4th priority group, the last priority group, and I will wait my turn. Along with the vast majority of the senior team at HHS, we will get vaccinated in accordance with the lottery as part of the 4th group to get access. Still, I know many are feeling that they are in risky situations every day, and this can't happen fast enough. I wish we could get it in everybody's arm today, but that is just not possible. I think it's of some comfort that we have a good supply of PPE, which was such a big concern during the first wave. Notwithstanding that, I know we've still had outbreaks because this virus is so sneaky, but for the most part, I want to say, I think everybody has done such a good job protecting themselves and our patients with the PPE that we have. And we have to continue to rely on that for the next few weeks and beyond while the vaccination program is unfolding. Of course, all of this is dependent on the continued provision of vaccine doses by the province, but we are seeing some firming up of the supply chain. So having said all that, I'm going to turn it over to Leslie to share more details about the vaccination process for the team here at Hamilton Health Sciences.
I actually think Bruce is going next.
Oh, apologies. Over to you, Bruce.
Yeah, that's okay. Thanks very much, Rob, and thanks everyone for joining us today. So I will be quick. Rob has done a really great job of outlining the process before we move to Les to talk about sequencing. But I do want to highlight and reinforce that when Hamilton received notice that we would be receiving vaccine, a multi-organizational collaboration went into place. that included both of the two hospital systems, as well as Hamilton Public Health, both family health teams, the EMS, paramedic service in Hamilton, as well as all of the long-term care homes. As per that provincial guidance, vaccination through the clinic that was stood up at 293 Wellington, which does really involve collaboration with our Bay Area Research Trust partners as well. That group worked diligently to put that clinic in place right before Christmas. We have now, over the course of now 10 days of operation, vaccinated 2,300 plus individuals, and the clinic continues today, running from 11 to 7. Rob has identified the initial prioritization and sequencing from the province focused that vaccination on long-term care and retirement home staff because of the vulnerable population with whom they interact. We did also receive guidance that any unused doses, what we refer to as residual doses, could be allocated to healthcare workers at high risk. And so early on in these 10 days, we have been able to vaccinate approximately 300 staff and physicians across the two organizations using those residual doses. If I can go to the next slide, please. And I'm going to jump first to an update with respect to the vaccination clinic at HHS. As Rob has alluded to, we are looking to move that to much higher levels of administration. And so tomorrow we will be moving to provide 600 vaccinations per day, which means a significantly higher portion, higher number of hospital staff will be eligible on a daily basis to receive this vaccine. And Les Gauthier is going to talk to us about the sequencing of that. That number of approximately 600 per day using an 8-hour clinic day is going to continue starting tomorrow and through the weekend. On Monday, we will be further expanding that clinic to a 12-hour day, looking to approach 1,000 vaccines given on a daily basis. And so, as you can imagine, that will rapidly increase the provision and access of the vaccine to healthcare workers. This slide makes reference to the Moderna vaccine. Hamilton is expecting delivery of that vaccine early next week. And that vaccine will be provided to long-term care home and retirement home residents by public health. So they will be taking the vaccine to those groups to vaccinate that vulnerable population as quickly as possible. Again, as that is completed, then that will allow the entire province and here us in Hamilton to move that much more quickly to provide access to our populations. So as I turn it over to Les, I'd want to leave with the key message that as of tomorrow, we will be doubling the number of individuals receiving the vaccine in Hamilton. And on Monday, we will further increase that to approximately 1,000 per day. Next slide and over to Les Gauthier, please, to discuss the sequencing.
Thanks, Bruce. And I'd just like to start to say Happy New Year to people. So this is pretty exciting work. And as we have come together, and Bruce and Rob have both alluded, we're working very closely with St. Joe's in that the clinic that is at 293 Wellington will serve both organizations and all sites. So we have brought a team together. We've aligned the work to the provincial framework, and really important key, first, the important key concept is as we've looked through the capacity of the clinic and our understanding of how much vaccine we have, everyone who wants a vaccine should be vaccinated by March. what we had to do was determine who would be the first group in the sequence that we would be reaching out to for appointments. So aligned to the province, group 1 is those individuals who are working in clinical areas with the highest risk of COVID exposure. And we recognize there's risk of exposure everywhere. These are the teams in the COVID units, the EDs, the critical care units, teams that are doing aerosol generating medical procedures. And also important that people understand is the team is all inclusive. So yes, it's our physicians, it's our frontline nurses, respiratory therapists, it's our cleaning teams, it's our porters. So if you are, as an individual working in these areas, you will be asked to self-identify as you belong to group 1. The second group in sequencing who will be invited into, everyone's going to be invited in, it'll be the sequence at which we will contact you, are those teams who are caring for patient populations. So who are our most vulnerable patients across the hospitals? Obviously, hematology, oncology, and special risk to stem cell populations, the complex hematology. Also included in this group are the frail, elderly, vulnerable medical populations. For our St. Joseph's colleagues, the renal patients, and in particular, the renal transplant. And you're going to see there's a very detailed chart that outlines who all these individuals are. Group 3, and we anticipate we'll be at this group by the end of February, is everyone else who's patient facing forward. So all of the other ambulatory clinics, inpatient units, the rest of the teams that provide procedural care but aren't in the room for intubation, as an example. And then the final group is all other hospital workers. Identified here are people who are not patient focused, forward facing. Also identified here are other people who are remotely working from home. And as Rob has already alluded to, for sure our senior team identify ourselves that we will belong in group 4. So if I can have the next slide, please. So where are we heading? So Bruce has already said we are absolutely ramping up the clinic, and we're starting tomorrow at 600 people a day capacity. So this includes the capacity for our continued commitment to long-term care employees and then the HHS and St. Joe's team. The goal is to have everyone vaccinated by the end of March, and this is obviously dependent around the continued supply of our vaccines arriving. And so we will work and adjust the clinic to as our supply is available. Come to the next slide, please. So what do you need to know from today? So people will see a tool, a link that will come across from our communications team. The tool is designed very, very similar to your self-screening tool that you use every day. And what we're asking people, we really want people as soon as you can to go on your mobile device or on your local computer and sign up online. When you go to sign up, you will be asked to for a confidentiality release related to your phone number, your date of birth is there. So you'll sign off for the confidentiality. You will be then asked to identify which of those 4 groups in sequence that you see yourself belonging to. And we are really dependent that people are going to be very ethical and align themselves to the framework as people submit. I'm in priority or the first sequence group. And then the way it will work is it will be a randomized electronic draw every day. So if we have 500 spots the next day to vaccinate frontline teams, the night before we will be getting a randomized list and people will be calling out. Actually, I think you can move me to my next slide. People will be calling out to confirm with you, you've been selected by the randomization. Are you available to come to the clinic at 1 o'clock? Some people will be called and offered appointments on days that you are working. Other people will be offered on days that you are not scheduled to work. It's completely randomized. It really is our hope that people will be able to accept the appointments as you have conversations with the booking clerks. And we know we're asking people on the frontline teams, could be a little bumpy. I'm being very honest. It is randomized. So there might be 3 people on a unit who get called for Thursday, and really working with your manager and charge roles or people you report to help support people to get to Wellington for their tests or their vaccination. Okay, the next slide, please. So we're starting tomorrow with the ramp up through this randomized process. When we're at full capacity, as Bruce has just alluded, we anticipate we could be up to 1,000 client visits a day. Still remembering, we still have a commitment to some long-term staff out of that 1,000. And every day the process will repeat itself. So if you're in the highest sequence group, the ones, the tool's going to keep pulling your names forward until we've completed or near completion the ones. If there's still capacity in a day, for one day, we could pull some people off of 2. So it's a very fluid tool, and it's really intended to, I'll use my favorite expression, to keep our pump primed, that we always have line of sight to who is in the next sequence group, and we'll pull you up and we'll reach out to you. So one day we could be reaching out to people in the group 1 and 2. The next day we could be completely back at group 1. It will be dependent on the sequence to which people put their names in to be vaccinated. Kevin, thanks. So we're just going to continue to do this. The tool is very fluid. And if anything changes in provincial guidelines that a certain population is identified as a higher risk, we'll have the capacity to make that adjustment within the tool. So what we really want, and we want to waste no spots in the clinic. So when you do sign up, you will be asked if you're willing to be on standby. And standby means at the end of any day, you could come within an hour, arrive at the clinic within an hour. There will be a daily process in the clinic as we're closely watching the number of doses that we've thawed. If we have extra drug, we'll be reaching out to that standby list to get people as quickly as possible into the clinic to take the end of the day vaccinations. Again, I remind everyone, although we've talked about sequencing groups 1 to 4, I think 10 weeks is going to go super fast for us. And our real hope is that our entire teams, whoever wants the vaccinations, will be able to receive one by March. Okay, so I'm going to turn it over to Dr. Stacy, and then I'm going to come back and finish after Michael.
Yeah, thanks, Leslie. Firstly, I just wanted to really just put out a thank you to all of the staff, including physicians and residents, for the tremendous work that you've done throughout this pandemic. And I think that we really, as an organisation, appreciate your dedication to the patients who come into the organisation, particularly given the circumstances that everyone's working in. And as well, I think we all owe a deep debt of gratitude to the people who've stood up this vaccination clinic. I mean, they've worked tirelessly from not long before Christmas to get this up and running, to ramp it up, to be able to deliver the vaccine to everybody. So a great vote of thanks to all of them. Just to comment to Rob's point earlier, I know a number of the physician colleagues have reached out to say that their colleagues in other parts of the province have already been vaccinated. And to Rob's point, I mean, we were not in the first group of cities and hospitals that received the vaccine, and we're several weeks behind them, but we are catching up, and our intent is to get all of you vaccinated as quickly as we can. Next slide, please. Just for the physicians and residents and fellows, you'll be following the same sequencing as other healthcare workers based on the guidelines. And, again, we aim to get those in the highest risk areas vaccinated to begin in the first groups. We are working very closely with St. Joe's. So this is a combined effort between the 2 organisations. So following very similar principles throughout both organisations. So, when you're in communication with your colleagues from St. Joe's, be assured that we're working together on this. And I think as has been said several times, I mean, the plan is for everyone who wishes to receive a vaccination to get it by the end of March or sooner. And with the infrastructure that's been set up, we could deliver that sooner. It'll be just simply dependent on whether we have enough supplies of the vaccine to deliver that as quickly as we would like. We do hope there'll only be a few weeks between all groups receiving the vaccine. And as I mentioned before, the endeavour is to get all of the staff in the organisation who want a vaccine to get that as quickly as we can. So reassuring you, that is fully the intention, and you've seen the excellent work that's been done to get to this point. I'll hand back to Leslie.
Thanks, Michael. And so I'm following, there's a ton of questions, and we anticipated there would be a lot of questions today. Our communications team is going to share a message around the vaccination for our staff, physicians, residents, and learners. Attached in that communication is the sequencing framework. So when you look at that framework, you will see the provincial criteria of who's in the first group to the fourth group, which I'll summarize: highest risk of our teams to be caring for COVID. The second group is teams caring for patients who are at the highest risk if they were to contact COVID. The third group is everyone else who is forward facing in providing care to our patients. And the last group is really those of us who are not forward facing. We anticipate there's going to be lots of questions around where does my unit fit, and really happy to field those questions. There are some questions already appearing in the chat asking people, I have a personal issue, and can I be sequenced earlier? The way the system is designed, it's addressing teams. It does not address individual unique situations. And quite honestly, we don't want to be in knowledge of everyone's personal health information. If you have a very specific issue that we're assuming you're working through employee health with, but the process is not designed to address individuals. And I'll just state that up front. So I'm going to go back to everyone will get a vaccine in the 10 to 12 weeks. It is voluntary. We're highly recommending, and there is information you'll see in the FAQs around the vaccine and where to go if you have more questions. We are asking people to use your personal device or computer, sign up to be in the lottery each day to be called. There is a consent form there, and the province requires that you have your health card with you when you're called. So if you're putting yourself on standby, important to remember to bring your health card with you to work every day. Again, I'm asking everyone's conscious, if you accept an appointment, I think super important that you show up for your appointment. The vaccine clinic availability is a relatively scarce resource, or an important resource. We do not want to waste none or waste any. So our goal is zero wastage. A reminder, when you accept your appointment, you are also committing to the follow-up appointment in 21 days. And we have to use a provincial tool around that follow-up appointment. So just that everyone's aware, it's, we're booking you once, and then the second booking would come 21 days later. And then if you are an individual and you have specific concerns, there's lots of conversation around pregnant women, breastfeeding women, people who are on certain therapies. Please ensure that you have those conversations with your healthcare provider in advance of coming into the clinic. And the next slide, I think, is my last slide. And now I'm wearing my PPE task force hat here. Super important. We have done a phenomenal job for the most part across HHS and really fighting the pandemic. And it comes, Rob's alluded to, the supply of PPE is a very stable supply. You have the tools in following the right PPE, making sure we're following good hand hygiene and washing or sanitizing your hands. and at all times trying to do our very best to maintain that social distance, and particularly if you're on breaks where your mask is off while you're eating and drinking. We just like to end the good news of vaccination of reminding people to continue to do the great work around what we've referred to as the 3 W's of COVID. So with that, I think I'm paused, and there's 76 questions and 26 comments in the chat room. So I'm going to hand it back over to my colleague, Aaron, to.
Yeah, thanks very much, Les. We won't be able to get to all the questions, but I think we're going to extend, we are at time, but we're going to extend our time to be able to do that, to answer a few of them. I've seen a lot of questions. I'm going to try and pose a few thematically that I'm seeing out of the Q&A box. One is about pre-existing health conditions, those cancers mentioned a few times, maybe other health conditions. Does that eliminate anyone from receiving the vaccination, or is there any advice on how to understand that when registering?
So I'll take that one to start. I mean, it's back to the message I just gave. If you have a personal health issue and you need clarification, our guidance right now is that you seek that out from your personal healthcare team. There is some general information that's included in the FAQs that will go out today, but we're really depending that you'll have those conversations with the healthcare team that knows you best.
Thanks very much. Just should point out to everybody that I see a lot of questions about where to get the link. That information is coming at the conclusion of this webinar. So there will be an all staff email sent out. It will also be emailed out through the faculty to all residents. We'll also have information posted on the Hub and via the Hub app. We'll keep cycling that information through social media and email over the next, as long as it takes, to make sure that everybody has the sign up link. So that information is definitely coming. Okay, so going back to our Q&A here, why don't I take a look back. Sorry, one moment, please. There was some inquiry here about people that might be doing rotations across different kinds of units and who might be in perhaps one tier in one rotation, but in another in the second in terms of the sequencing. I don't know if somebody can talk to how that might be handled when you know you're going to be traversing from one place to the other.
Thanks, Aaron. So I'm going to theme a couple of things I'm seeing in the Q&A in the chat line. So this work has been done with St. Joe's. The actual lottery and the registry that your names are going to be put forward in is a combined registry with St. Joe's. So St. Joe's staff, St. Joe's physicians, the residents for the city, and all of the HHS sites will be in that same lottery. So for residents, in some of the questions we fielded is you're now doing a rotation on a surgical unit, but you believe in 2 weeks you're going to go to the ICU. We're asking our residents to identify where you are going to be next. And there's work that will come through from Dr. Wassi's office, I believe, that will just give you some instructions. We want people identifying the highest grouping. So where the greatest risk could be to you when you complete the sequencing framework. So if you are a physician and you cross multiple units, but you're going to be in the emerge and you're going to be seeing COVID patients, pick that group.
Question, just to also give everyone peace of mind, we will endeavor to go through the question list, unanswered questions. We'll do our best to post the information on the Hub, as has been our practice for our town halls throughout the pandemic. We will do that, no doubt, today as best we can, as quickly as we can. So if your question's not answered, we'll do our best, at least in this session, we'll do our best to get you a written answer posted on the Hub. A question I see coming up here on the occasion is around the issue of maternity leave or pregnancy, those that might be on maternity leave now and coming back, or poised to take maternity leave, or even the safety of the vaccine for those that are pregnant. Can someone comment on that?
Thanks, Aaron. I can comment on the last piece. Certainly, we are, I think, all aware that the vaccine was not actually tested on pregnant women, as well as a number of other groups. However, the leading medical groups, including the SOGC and just now the Provincial Council on Maternal Child Health in Ontario, are issuing guidance that does support pregnant women to receive the vaccine in consultation with their health provider. And so we are encouraging, and that group thinks that that it is very appropriate for pregnant women looking individually to be eligible and to receive the vaccine. So I'll stop on that point. Les probably wants to jump in on the process as it relates to those on leave.
Right. So thanks, Bruce. So the tool's really fluid. So if someone's on a leave, as they're coming back, they complete their form and their name goes into the lottery. It will change and update every single day. Right now, our focus is on our employees, staff, and physicians who are at work. So we're not looking to be vaccinating as the first highest groups. People who are off on leave and not coming to work. But as soon as you are coming back onto our teams, absolutely, you click on the link and your name goes into the process. And depending on where you are in the sequencing, you'll be prioritized in the randomization. At the same time, I'm seeing some questions here around learners. So our residents and fellows are in the same grouping across the board as all other staff and physicians. At this time, all other learners are in the last sequencing group. And that is because the provincial direction we have been given is to first ensure our frontline teams and physicians are vaccinated. So we have included the learners, but they're in the end of the staging.
Thanks very much, Leslie. I do see about a dozen questions too related, generally speaking, to the receipt of the second dose in terms of scheduling and approach and reservation of those dosages. I know, Rob, you commented in your remarks at the outset that we're prioritizing an accelerated distribution approach at the recommendation of General Hillier in the province. Could you comment again on just what are the risks to supply and how we're navigating that issue?
Yeah, we are taking at the direction of the province an aggressive approach to getting the vaccine to as many people as possible. So we are relying on the province supplying a steady supply chain of the vaccine as time moves forward. If there is an interruption to that, we'll have to deal with it when it happens. But as I said, we are proceeding in a manner that is the same as other clinics, the other 18 hospitals across the province, in being as aggressive as we can in getting needles in as many arms as possible.
Thanks very much. And then again, I have seen a couple of questions about the standby process. How does one, register to be on standby or know if they're being considered in the standby box as well? Leslie, can you comment a bit on that again, please?
Yeah, so this goes to the overriding principle. We do not want to waste any opportunity to vaccinate people. So as we've rolled out over Christmas, every day at the end of the day, if there were vaccines that were thought and available, we had an agreement that we would make calls out to the COVID units at both HHS and St. Joe's and see if they had available staff that could come over to the clinic and be vaccinated. That's a process very much in line with the rest of the province. We are going to build on that process because we do recognize there's risk in the current model that we could have spaces at the end of the day. So when you go onto your device and sign on, you'll get asked, do you want to put yourself on standby every day to get a phone call if we have capacity? And again, that will just be a randomized list that will get printed off at a point in the day and start making phone calls. Can you come over, in 30 minutes? Can you come over in an hour?
Just seeing here in the Q&A, a couple, not always repeating, but similar thematics. It is for HHS employees and hospital employees only, not extended family. There is no cost for the vaccines, so no payment is required. The registration information, again, for those that might be joining the webinar late, is being sent out imminently via email and through a number of other sources to make sure that everyone has access to that link. In terms of parking and accessibility at the vaccine center, those logistics have been thought through thoroughly, so there will be sufficient parking and to make sure that things are staggered throughout the day to not overwhelm the facility. You know, there might be logistical elements that need to be worked through as we go, but those have been duly considered by all involved. There are a number of questions here about specific categories and classifications of jobs. I don't know, Leslie, maybe you could comment again. I don't know that we could get into each of them in detail. If there's something that's standing out here to you, or perhaps how people might be able to evaluate in terms of their own position and their risk level and the criteria where they fit in that sequencing.
Right. So when people see the actual tool for sequencing, you'll see teams listed, and then you'll see roles that may include. So if I talk through the first group, group 1, it includes the COVID medical units. It includes the adult and pediatric critical care units. It includes everyone on the Code Blue, race, rapid response, and protected Code Blue teams, all of our emergency departments, and that extends to the JCC rescue, labor and delivery. It includes all adult general internal medicine units, the COVID assessment teams, and a bullet that says other staff and physicians participating in high-risk AGMPs, which would be the anesthetist and the RNs in the OR. It could include the bronchoscopist and the endoscopy nurse. It could include the brachytherapy team at the JCC. The chart then lists all of the roles to think about. So we have not gone through every employee in every department. We're asking people to say, are you a porter? Do you go in and out of the emergency department? Would you see yourself in this high risk group? If you do, it's yes. It's obviously physicians, allied health. If you're a pharmacy technician doing best practice medication history in the emerge, you'll say yes. If you're a pharmacy tech and you work in a much lower patient risk group, you won't consider yourself in group 1. Group 2 are the teams who are caring for the most vulnerable patients to COVID. So if you see yourself as a team member on the stem cell unit, you're going to be yes. If you're a team member in the transplant unit at St. Joe's, you're going to say yes. If you work on the long-term care units, you're a yes. So again, we're including, and the chart is really meant to acknowledge that it's to the entire team. It's not specific to roles. So I'm very happy to field any individual questions that people have. Where do you see yourself or your team on the chart? I do think it's going to take some conversations with people with their leadership team. And if there are teams who are not comfortable or think the group has missed something, Dr. Flagiol, who is the co-lead of the vaccine task force, and myself will work together to bring together a group to consider the requests. But we've really tried to keep it very simple. It is the highest risk. So happy for further questions on it.
And then in terms of, can you remind the group just in terms of the delta of time then between, I know we can't make any guarantees, we're working as quickly as we possibly can, but between group 1 and group 4, what's the order of time that you're considering at this, given our approximate ability to distribute?
Yeah, so this is changing as the clinic capacity changes and the vaccine availability changes. We think it's going to take us 1 to 2 weeks through the first sequence group, 1 to 2 weeks to get through the second sequence group, 3 to 4 weeks, because the bulk of people across HHS and St. Joe's are going to be in the group 3, forward facing for patients, but not the highest of risk. And then the last group, back office, people who aren't forward facing, that team is going to take probably about a week. So really hoping early in March, we're well on our way to having everyone who wants a vaccine vaccinated.
I see some questions too about age in terms of, is that a risk factor for consideration for those employees that might be over the age of 70 or 60, or given the known risk of COVID for all of us as we age? Is that a consideration in the sequencing?
So I'm going back to the overriding principle that the framework was developed to address teams. There is not a process to consider individuals within this framework. And that is consistently being applied across the province as well.
Understood. Dr. Stacey, I see a series of questions about our medical residents. Maybe I could ask you, I don't know if you've been, I think you've probably been reading those as well. If you could maybe comment on some of the questions. There are some thematic issues there. Perhaps you could address some of those.
Yeah, thanks, Aaron. Yeah, I was noticing some of those questions about residents, and I think there was a misconception that the residents fall into the last group. And I think, as Leslie has said, they align with the teams. So where they're part of one of those frontline teams, they will get vaccinated along with the other members of the team. So just to reassure any physicians or residents listening that they fall into that group. So they're not at the back end of the sequencing. They'll fit in with the different groups within the sequence.
Good, thank you for that. Just again, reminder to all of our participants today that questions that haven't been answered, we'll do our very best to answer those as quickly as possible. We have gone over time today, but I think it is appropriate to do so given the volume of interest in that. We will have an FAQ and an email out very shortly to try and make sure that everybody has the available information to register. And we'll take a good long look at all of the questions that are accumulated here to make sure we get a response to those. We do have also the option for people to send additional questions to hhsnews@hhsc.ca, the email line, the question email line that's highlighted on the screen now. Please do that and you'll get an answer back as soon as possible via email. We also do have a town hall scheduled for tomorrow, and I suspect while we don't have as much time devoted to this topic specifically, we'll be able to answer more questions tomorrow on the topic of the vaccine, and subsequently thereafter. We won't stop until everybody has the information that they need. So I'm going to conclude things there and thank our participants and our presenters as well today. Rob, maybe just some closing remarks from you and then we can part.
Yeah, I'd like to just close by, of course, thanking everybody for coming today. And we appreciate the level of engagement. I know it's a very important topic for people, for all of us. So thanks for coming and thanks for listening so closely. This is, I know there continue to be lots of concerns and questions, but it is at least a bright spot in our battle against this virus. And I wanted to echo Michael Stacey's words in complimenting the team led by Les Gauthier, Bruce Squires, and Dave McKeag, and everybody who has supported them. It is pretty amazing. You know, we really only knew that we were going to be in this game virtually the week before Christmas. And so we have made great strides in that fairly short period of time. As I said earlier, I wish we could get a needle in everybody's arm today, but we will continue to work as hard as we can and as fast as we can to get everybody vaccinated. So thanks all, and please join us again tomorrow at tomorrow's town hall if you'd like, where we'll be dealing with more broadly the pandemic, but hopefully we could also touch on the vaccine tomorrow as well. So thanks all, and cheers. Thanks for all your hard work.